The coronavirus pandemic has now killed over 400,000 people around the world, with the United States having the largest number of fatalities, over 110,000. The United Kingdom, Brazil, and Italy follow, with each nation's death toll exceeding 30,000. With many nations and states now reopening, public health officials warn that a loosening of social distancing practices will likely generate a second wave of COVID-19 infections that could delay a return to economic and social normalcy. While the U.S. leads the world in the number of cases and deaths from the coronavirus, the island nation of Cuba has one of the lowest rates of infection. In addition, Cuba has continued its 60-year practice of sending doctors and other medical personnel abroad to more than 160 countries. And for the first time this year, Cuba has sent their physicians to 2 European nations, Italy and Andorra, to assist local medical workers care for coronavirus patients. Between the lines, Melinda Tuhu spoke with Helen Yaffe, a PhD lecturer in economics and social history at the University of Glasgow in Scotland. Here she explains how Cuba's socialist system has developed a public health infrastructure to serve all its citizens and is sharing that knowledge with nations around the world.
So I think the first element of importance here for assessing Cuba's response to the COVID-19 pandemic is how quickly they responded. So news only came out at the very end of December about this new virus. And by January, the Cubans had drafted a control and prevention plan. They had established a national intersectoral commission for COVID-19. National plan for epidemics was updated. They began surveillance at ports and marines, and they sent, experts to China to observe the disease there. They have good relations with China in these issues of medical science and health. So they took it very seriously. They then proceeded to train anyone who was involved in any way with the healthcare sector, starting with sort of directors of hospitals and polyclinics who would then go and train their colleagues in the different provinces and municipalities. But they also even gave this training to porters, anyone who was dealing with hospital transport, anyone who may in any way come in contact with a patient. All of this was done before the first case of COVID-19 was confirmed in Cuba, which was on the 11th of March when 3 Italian tourists were confirmed as being infected. They also then went on to organize neighborhood meetings. So they have an incredible system of grassroots community organization in Cuba. They have what they call the organizations of the masses. And a key one of those is the street committees, the CDRs. And they are very capable of mobilizing basically the whole country, but through these sort of localized street committees. And the local doctors and nurses came down and explained to people about this new virus and gave them advice on, protective measures and so on. They have this capacity to mobilize the population. But in terms of healthcare, this is enacted through their incredible universal system of public free healthcare. So they don't have a dual-track system with a public health and private. It's a public healthcare system for everyone.
Helen Yaffe, it makes sense with a centralized system that you could do all this. But people in the U.S. are comparing San Francisco, which has had just a handful of deaths from COVID-19, and New York, which has been a disaster. So it seems that with any well-thought-out humane plan, a city or state or even a country could keep the numbers very low without being a socialist system. Your thoughts?
I'll say something a little bit controversial. Capitalist systems, historically, when they are in crisis, have adopted mechanisms that we associate with socialism, or certainly with the state managing the economy and society.
I wanted to talk a little bit about the Cuban response internationally, which helps others but also boosts their own standing in the world. You said that since 1960, they've sent 400,000 healthcare professionals who've worked in 164 countries pre-COVID. I assume they work with the medical people in the host countries?
They never go without invitation, so clearly they are collaborating with healthcare authorities. And the missions have very different forms and the nature of them is different. So some of those are in response to natural disasters and disease outbreaks, so they're emergency response. Some of those are at the invitation of authorities to help establish a public healthcare system. At the same time, the Cubans have never sought to create a dependence on their healthcare workers. They have always trained the local people, taken either on site in those countries, or often they have invited tens of thousands of foreigners into Cuba to get medical training so that they can gradually replace their own personnel and set up a public healthcare system.
What has been the response specifically to COVID-19?
At the moment, they're emergency brigades, so the brigades that have gone to respond to, who have personnel with expertise in disease controls and disaster response, those are the Henry Reeve brigades, and they have gone to 24 countries as far as we know, and that's some 2,300 professionals.
That was Cuba expert Helen Yaffe, a PhD lecturer in economic and social history at the University of Glasgow in Scotland. Learn more about how Cuba is effectively combating the coronavirus and is sharing that knowledge with other nations by visiting our Between the Lines website at btlonline.org.